Hello, everyone. Today we're going to explore a fundamental topic in psychology and mental health: the difference between psychosis and neurosis. These two terms might sound similar, but they describe very different conditions, each with its own set of symptoms, implications, and treatment approaches. To understand these differences, let's break it down into main aspects: definition, symptoms and experiences, and treatment and outcome. 1. Definitions. Let's start with some definitions. Neurosis refers to a broad category of mild mental health conditions. These conditions are usually anxiety-driven, where a person remains in touch with reality but experiences distressing emotional symptoms. Examples include anxiety disorders, obsessive-compulsive disorder, OCD, and phobia. On the other hand, psychosis is a more severe mental disorder where a person loses touch with reality. This could involve experiencing hallucinations, delusions, and severely disorganized thinking. Psychosis is commonly seen in conditions like schizophrenia, bipolar disorder during manic episodes, or as a symptom of severe depression. To sum it up, with neurosis, reality remains intact, though the person struggles emotionally. With psychosis, reality becomes distorted or lost altogether. 2. Symptoms and experiences. Let's take a closer look at the symptoms. In neurosis, the primary symptoms revolve around anxiety, fear, and emotional distress. For instance, someone with an anxiety disorder might feel excessively worried or tense, even in non-threatening situations. A person with OCD could experience intrusive thoughts and feel compelled to perform certain rituals to ease their anxiety. Despite these challenges, a person with neurosis usually remains aware that their fears or behaviors are irrational. They may feel trapped by their symptoms but can still distinguish between what is real and what is not. Now, with psychosis, the situation is quite different. The symptoms include hallucination. This involves seeing, hearing, or sensing things that aren't actually present. For example, hearing voices that no one else can hear. Delusion. These are firmly held false beliefs that don't align with reality. A person might believe they have superpowers, or that someone is plotting against them, despite clear evidence to the contrary. Disorganized thinking and behavior. This could manifest as incoherent speech, erratic actions, or confusion. The key here is that, unlike neurosis, people experiencing psychosis are disconnected from reality and may not be aware that their perceptions or beliefs are incorrect.
Treatment and outcomes. So how are these conditions treated, and what are the outcomes? For neurosis, treatment often involves therapy, particularly cognitive behavioral therapy, CBT, which helps people manage their thoughts and behaviors. Medications like antidepressants or anti-anxiety drugs might be prescribed as well. With consistent treatment, many people with neurosis can significantly reduce their symptoms and lead stable, functional lives. For psychosis, the treatment is more intensive. Antipsychotic medications are typically required to help control symptoms. Therapy also plays a role, particularly in helping the person rebuild a sense of reality and develop coping strategies. In more severe cases, hospitalization might be necessary to stabilize the person. The long-term outcome varies depending on the underlying condition, but ongoing treatment is often needed. 4. Stigma and misconceptions. Before we wrap up, it's important to touch on stigma and misconceptions. Both psychosis and neurosis are often misunderstood by the public. People with neurosis might be labeled as overly anxious or obsessive without understanding the depth of their struggle. Those with psychosis, on the other hand, are sometimes unfairly associated with being dangerous or violent, which is rarely the case. It's crucial to approach both conditions with empathy and understanding, recognizing that these are medical issues that require professional treatment. Conclusion. In conclusion, while psychosis and neurosis both involve mental health challenges, they differ significantly in terms of reality perception, symptom severity, and treatment approaches. Neurosis typically involves intense emotional distress while maintaining a grip on reality, while psychosis involves a break from reality that can be disorienting and distressing. Understanding these differences can help us better support those around us who might be experiencing mental health difficulties, and encourage a compassionate, informed approach when discussing these topics. Thank you for listening, and I hope this explanation has provided you with some clarity on the distinctions between psychosis and neurosis.